Duchenne muscular dystrophy is a well-known disease. It was already identified many years ago, but we now know that it's caused by a mutation in a gene that produces what the body needs to protect its muscles. So without this proteins being produced, what you have is a slow but continuous breakdown of the muscles in a child's body. By the time they're in their teens, they will usually be wheelchair bound, and the average lifespan for someone with Duchenne's is about 27 years. This is almost exclusively found in boys. Females carry the disease but are very rarely affected. The approximations are about 1 in every 3,500 boys will be diagnosed with Duchenne. The Association Duchenne Israel is a very important organization. It's made up exclusively of parents with children that are suffering from Duchenne's, and they're very committed to supporting research and advocating for their children and trying to find a cure. The medical or science component of the association had noticed our information and our data out of our muscle injury trial, and they approached us and they asked if they could support some work in Duchenne's to see if our cells would be helpful in that area, in that indication. So we were very happy to help, and we donated our cells, and they supported a few studies in animals and preclinical models to see how our cells would function or help in the Duchenne, and we had very nice results in these initial trials. Studies that were supported by the association had some very positive and promising data. One of the things that we saw in these studies was that the level of CPK in the animals who had been treated with our cells were about 50% lower after treatment as compared to those who had received a control substance. What this means is that the CPK is a marker of muscle damage or injury or degeneration. And so it's a sign or a signal, so to speak, that the cells are helping the muscles to heal or to reduce their degeneration as the disease progresses. We really hope that in the future, cell therapy may be a potential treatment for some of the symptoms of Duchenne. With this very positive preclinical data, the next step for us is to explore the feasibility of a clinical trial moving forward. One of the things we will need to do as we explore this idea is to speak with patient advocacy groups and others who are invested in the Duchenne space and slowly figure out where we can go with this data that we have now.